The term OSA, or obstructive sleep apnea, is becoming very common. More and more people are being diagnosed with OSA as the field of sleep medicine learns more about its symptoms, presentations, short and long-term effects. So, what exactly is sleep apnea? What are the most visible signs that you might have it? Today, we'll discuss the 13 signs of sleep apnea that you should look out for. Before we continue, don't forget to leave a like and subscribe. If you or a loved one may be experiencing OSA, please consult with a trained, licensed medical professional. Apnea is the term for when breathing stops and starts while you're sleeping. A person may still be breathing, but their airflow may be diminished or interrupted. The muscles in the neck and throat relax while you sleep, and the soft tissue in the back of your throat shrinks. The soft tissue's loss of volume causes the upper airway to become obstructed. The blockage of the upper airway results in breathing pauses, both complete and partial. The breaks are at least 10 seconds long, and occasionally even 30. There may be lengthier pauses in more severe cases. What effects do these pauses have? They significantly reduce blood oxygen saturation, hypoxemia. A shortage of oxygen stimulates your brain. It sends a signal to your body telling it to wake up from sleep, so you can start breathing normally again. You continue to sleep. Another pause. The brain kicks in, and your body wakes up. This trend repeats itself throughout the night. You end up having a restless night and waking up feeling exhausted. Disturbed sleep also contributes to a lot of other major health problems. The following are warning signs and symptoms of sleep apnea. 1. Noisy snoring. The first thing that comes into mind when most people think about obstructive sleep apnea is loud snoring. Most individuals with OSA snore. However, snoring alone does not necessarily indicate OSA. Snoring is caused by a partial obstruction of the upper airway, which is caused by air vibrating in the upper respiratory system as it attempts to pass through the soft tissues of the throat. Most people who snore regularly might not even be aware of it because it typically happens when you sleep. Most of the time, their bed companion or spouse is the one to notice the snoring. 2. Frequently pausing to breathe while sleeping. People with sleep apnea may experience prolonged pauses in breathing due to the restriction of airflow. Your brain briefly awakens as a result, forcing you to take a big breath in order to overcome the obstruction. Individuals with moderate to severe sleep apnea might have up to 30 apnea episodes each hour, each lasting 10 to 30 seconds. 2. Sudden gasping or choking. This indicates shortness of breath, which is when you're attempting to catch your breath. Sometimes people with OSA don't remember choking on bodily fluids like saliva or gasping for air. 3. Daytime inertia or daytime sleepiness. Excessive daytime sleepiness is another common sign of OSA. Drowsiness, weariness, and lethargy are some of the negative symptoms. Some people claim that at any given time during the day, they unknowingly fall asleep. 4. Dry mouth or sore throat. Although a dry mouth at first glance would indicate that you are mouth breathing while you sleep, OSA is another key indicator. People with OSA are twice as likely to consistently have dry mouth than people without OSA. Additionally, those with dry mouth may awaken with sore throats sometimes, but not always. 5. Morning headaches. About 30% of sleep apnea sufferers claim to have headaches when they awake in the morning. The exact cause of the headache is unknown, but Beth Malau, MD, the director of the Vanderbilt Sleep Division at the Vanderbilt University Medical Center in Nashville, Tennessee, suggests that it might be due to decreased oxygen in the blood, as well as dilations of blood vessels in your brain. These headaches typically happen frequently, affect different parts of the brain as opposed to only one side as in a migraine, and go away on their own a few hours after waking up. 6. Trouble focusing and concentrating. Insufficient sleep can cause brain fog in our brains. This makes it difficult to maintain focus on simple to complex tasks. 7. Easily irritated or depressed. While we sleep, the brain makes important repairs and restorations. Your brain performs poorly if we aren't getting enough sleep. The neurotransmitters involved with mood are adversely affected by sleep apnea. This alteration in the chemistry of the brain might result in mood swings, depression, irritability, and other concerns. 8. Unable to sleep in comfortable position. If you wake up during the night a lot due to OSA, it could be difficult to find a comfortable position. You might start tossing and turning more or ruffling the bed sheets. 9. Having a hard time waking up in the morning. Again, it is difficult to wake up in the morning since you are not receiving enough sleep at night. Since you don't feel rested, you want to remain in bed. 10. Uncontrolled hypertension. Up to 50% of individuals who have hypertension or high blood pressure also have sleep apnea, according to the American College of Cardiology. Mir Krieger, MD, a professor of sleep medicine at Yale School of Medicine in New Haven, Connecticut, explains that when a person with sleep apnea encounters a stop in their breathing while they are asleep, their sympathetic nervous system is stimulated and their blood pressure increases. Additionally, your body produces chemicals during stress that can raise blood pressure. Resistant hypertension, or the inability to drop blood pressure after taking at least 2 medications to treat high blood pressure, is a red flag, according to Krieger. The good news is that these individuals' blood pressure typically rises when their sleep apnea is identified and treated with continuous positive airway pressure, or CPAP, a machine that employs light air pressure to keep airways open while they sleep. 11. Lower libido. The hormones that cause sexual desire are regulated by the brain. When your brain isn't functioning due to sleep disruption, these hormones are directly affected. A rising number of research are confirming the link between sleep apnea and reduced libido. 12. Nights of insomnia. Krieger claims that if you have sleep apnea, you can find that you wake up frequently at night and think you might have insomnia. We see this a lot, especially in women. They complain to their doctor about having trouble falling asleep, and they get diagnosed with anxiety and are given sleeping medications, which can increase their apnea, he explains. According to him, this is particularly true around perimenopause, when some women experience the onset of sleep apnea. A lot of physicians presume patients' sleep issues are caused by hot flashes and don't explore for underlying cause. 13. Frequent urination at night. Another typical sign is frequent urinating upon awakening. Some men make an appointment with a urologist because, in Sorcer's words, they assume they have a bladder problem because they get up to 5 times at night to use the bathroom. They genuinely have healthy bladders. Once their apnea is identified and treated, and they are sleeping more comfortably, they stop recognizing these sensations and stop getting up in the middle of the night to use the bathroom. We've reached the end of this video. Don't forget to leave a like and subscribe to our channel. Comment below if you have any signs and symptoms of sleep apnea. We hope to see you soon.